Dear patient, important advice to keep you safe from coronavirus, COVID-19. Information from the Department of Health and Social Care dated the 24th of February 2021. We're writing to you because new research commissioned by the Chief Medical Officer has recently enabled us to identify people who may be at increased risk of becoming seriously unwell from coronavirus. This is because of a combination of their individual characteristics and their underlying health conditions. This research means we want to offer you further advice and support. This letter explains why you may be at high risk and have been added to the list of people who are clinically extremely vulnerable, also known as the shielded patient list, and what advice and support is available to you. You may feel that at this stage of the pandemic, when rates of infection overall are declining, the advice is not relevant to you. However, we think it is important that you are aware of your risk status and of the support available to you, both now and from any future changes in the pandemic. This means that you can make an informed choice yourself. You may want to read this letter with a family member or carer to make sure you understand the advice it includes. Why you have been identified as someone who may now be at high risk. The government is always learning more about coronavirus and the things that might contribute to people becoming seriously ill. They asked a team of experts to look at data from the first wave of the pandemic to get a better understanding of the things that may mean someone is at a high risk of catching and becoming seriously unwell with coronavirus. By putting this new evidence into a risk model with information the NHS already holds, you have been identified as someone who may be at high risk. This is likely to be because you have a combination of underlying risk factors or health issues, which, when combined, indicates high risk. An extra cautious approach has been taken, so there is a chance that your risk is lower than estimated. Your GP will be made aware that you have been identified in this way. In the future, your risk may be reviewed further, and you will receive another letter if your risk level changes. You do not need to contact your GP about this letter. However, if you do not think you are at high risk or you are concerned about the impact of coronavirus on your health, then you can contact them or the hospital doctor you usually see. Your GP's contact details can be found later in this letter. Guidance for people identified now as at high risk. People in the high-risk category are formally known as clinically extremely vulnerable. People who are in this category are currently advised by the government to shield and stay at home as much as possible until the 31st of March, except to exercise or to attend health appointments, including, of course, for vaccination appointments. Even if they have had both vaccination doses, they should continue to follow these shielding measures as we continue to assess the impact of vaccination among all groups. You have been added to the list of people who are clinically extremely vulnerable. We currently advise you to follow shielding measures from the date of this letter until the 31st of March 2021. If you are currently employed, you are strongly encouraged to work from home if you can. If you cannot work from home, then you should not attend work. This letter is a formal shielding notification. If you are not able to work because you are following this advice, then you may be eligible for the Coronavirus Job Retention Scheme, or furlough, and you may wish to discuss this with your employer. This letter can act as evidence for your employer, including for statutory sick pay or SSP purposes, or Employment and Support Allowance or ESA, to show you cannot work outside your home whilst you are following these shielding measures. This is advice and not the law, so you can choose what action you take whilst continuing to follow all the basic rules that we all need to observe through the pandemic. Access to care and support. Please remember the NHS is open, and we urge you to continue to access all the NHS services you need. It is safer for you to use the NHS than to try to manage alone. If you need any additional support to follow the guidance, your local council may be able to help. You can contact your council and register for support at the Shielding Support website, www.gov.uk/coronavirus-shielding-support. You can find your local council's details at https://www.gov.uk/coronavirus-local-help. Further information on how to access help, including how to register for support, is in the attached guidance. This includes support available for shopping and collecting medicines. Please make sure your GP has your most up-to-date contact details, including home address, email address, and phone number, so that we can contact you quickly if government guidance changes in the future. Coronavirus vaccine. The coronavirus vaccine is likely to make an important contribution towards protecting you from coronavirus. If you are aged 70 or over and have not yet been offered the vaccine, please contact your GP to make a vaccination appointment as soon as you can. If you are aged below 70 and have not yet been offered the vaccine, the NHS will be in touch with you about this soon. How the NHS is using your personal information. A document called the Shielded Patient List Transparency Notice provides more information about the risk model used to identify that you may be at high risk and the factors it took into account. It also explains how the NHS uses your personal information to provide you with support. You can read this at https://digital.nhs.uk/coronavirus/shielded-patient-list/shielded-patient-list-transparency-notice. You can find out more about the risk model at https://digital.nhs.uk/coronavirus/risk-assessment/population. Keeping you updated. We recognize that this is a very difficult time for many people. We are grateful for your help in keeping yourself and others safe as we all seek to respond to coronavirus. We will continue to update you as the situation changes and will write to you again if the advice for clinically extremely vulnerable people, shielding guidance, is extended beyond the 31st of March. This letter has been sent to you by the NHS National Shielding Programme on behalf of the Department of Health and Social Care. This letter is available in different languages and formats, including EasyRead on gov.uk. For Braille or large print, call RNIB on 0303 123 9999.